Assalamu alaikum. Today we will discuss the osteology of the lower limb. The osteology of the lower limb starts with the pelvis. This is a hemipelvis, this is the sacrum, and this is a hip bone. This is the hip bone. There is another hip bone here, and both are articulate posteriorly, sacroiliac joint, and the two iliac bone articulate anteriorly on the symphysis pubis. Here where there's movement are the symphysis pubis. The hip bone actually consists of three bones. This part we call it the ilium, and this is the pubic bone, and this one here, the L shape, is the ischium. So the iliac bone, this one, and this is the pubic bone here, and this is the ischium. The iliac bone, this is the outer surface of the iliac bone, consists of the following. This is this outer border, we call it the iliac crest. This is the iliac crest. This crest will end here by anterior superior iliac spine. When you move your finger downward, there is another elevation, we call it anterior inferior iliac spine. Okay. Iliac crest, posteriorly, when you move it, there is another elevation here, spine here, we call it posterior superior iliac spine, and another one here is posterior inferior iliac spine. The inner surface of the iliac bone is concave, and there is a rough area posteriorly for articulation with the sacrum. The iliac bone with the pubic bone and the ischium, all of them articulate together in a depression. Here we call it the acetabulum. This is the acetabulum, and this is the site of attachment of these three bones. The other bone anteriorly here is the pubic bone. This is the pubic bone. This is the superior ramus of the pubic bone. Here is the pubic tubercle. This is pubic crest. This is the body of the pubic, and this is the inferior ramus of the pubic bone. Superior ramus of a pubic bone, body, and inferior ramus of a pubic bone. Pubic bone articulate with the other pubic bone through symphysis pubis, through the symphysis pubis, like that. Okay. The other part is the ischium. This is the ischium. The ischium is L-shaped bone, very thick bone, L-shaped bone, articulate with the other bone in the acetabulum, and articulate the ramus of the ischium here, and this is the body of the ischium here. The ramus of the ischium articulate with the inferior ramus of a pubic bone here, and there is here a tuberosity, we call it ischial tuberosity. Ischial tuberosity, where the people usually sit here. Ischial tuberosity. Inner side, there are a protrusion here, we call it the ischial spine. Above the ischial spine, there is a notch, we call it greater sciatic notch, and below the spine is another notch, we call it lesser sciatic notch. There is, from the sacrum from the sacrum to the spine, and from the sacrum to the tuberosity, ischial tuberosity, from the sacrum to the ischial spine, and from the sacrum to the ischial tuberosity, there are two ligaments, sacrospinous and sacrotuberous ligaments. These will convert these notches to a foramen, greater sciatic foramen and lesser sciatic foramen. Very important structure will pass through these two foramen. Here we have what we call obturator foramen. We call it obturator foramen. The most long bone, the longest bone in the body is the femur. The femur consists of the head of the femur. This is the head of the femur. This is circular, and it enters in the acetabulum. Look at the acetabulum here, to form the hip joint. To form the hip joint. The head is a circle. In the circle there is a depression. This is, we call it fova capitis, for the ligament of the head of the femur. Fova capitis, a depression. And the head here had neck. The neck articulate with the body of the join the body of the femur. The neck and the shaft, this neck and shaft, has an angle which is very important, because excessive angle would cause coxa valga, and less angle will form coxa vara. Here, this elevation here, we call it the greater trochanter, and here is the lesser trochanter. From the anteriorly, in the anterior surface, here the anterior surface, there is a line that passes from the greater trochanter to the lesser trochanter. Here we call it the intertrochanteric line. Intertrochanteric line. The shaft of the femur is round and long bone, and it ends here by a depression for the patellar fossa, and here is the medial